Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about tissue selection, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the second subsection of the specialist portfolio called tissue selection. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to help you guide the candidate to produce a really good portfolio. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the second subsection of the first section: tissue preparation techniques, tissue selection. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. Let's have a look at the first knowledge requirement, which is invasive and non-invasive surgical procedures and their relationship to the collection of histology and cytology specimens, fluid, biopsy, resection. Candidate needs to have the knowledge and understanding about invasive and non-invasive procedures, and their relationship to collection of specimens. You could ask the candidate to explain what invasive and non-invasive surgical procedures are, when it comes to sample collection for histology and cytology. When addressing this knowledge requirement, candidates should consider procedures like evacuation, aspiration, exfoliation, FNAs, FNBs, punches, curettage, EBIS, TURB, TURP, incisions, excisions, resections, and so on. You could ask them to specify which procedures are considered invasive and which are not. Candidate could also consider types of samples these procedures produce, like cores, punch biopsies, fluids, washes, bushes, and so on. You could ask them to explain when would each procedure be used, whether there is a difference how those obtained specimens are processed in the lab. Candidates should consider diagnostic versus therapeutic reasons for specimen collection as well. The second knowledge requirement is key anatomical specimen sites. Candidates should know the key anatomical specimen sites. You could ask them to name anatomical specimen sites and name types of specimens that are received in your lab from those sites. When addressing this knowledge requirement, candidates should consider anatomical sites like cardiothoracic, neuroendocrine, GI, or osteoarticular. You could ask them to state what types of samples would be taken from those anatomical sites. Candidate could consider shave, core, loop, wedge, and others. You could also ask them about the procedures that would be used to obtain tissue from those sites. This would allow them to link this knowledge requirement to the previous one. The third knowledge requirement is principles of tissue selection and the factors that need to be considered. Candidates should know the principles of tissue selection and the factors that need to be considered. You could ask the candidate to explain what are the principles of tissue selection in histopathology, and how would they know what tissue part needs to be selected for histological analysis. When addressing this knowledge requirement, candidates should consider location of the tissue or abnormality, size and type of the tissue, relevant margins, abnormal areas, surrounding normal tissue, sample representation, and so on. You could ask them about the factors that need to be considered when selecting tissue histological analysis. They should consider the size of the abnormality, margins, need for orientation, presence of calcification, access to macropath images, RC-path guidelines, and so on. You could ask them to explain why those factors are important, and what would happen if a wrong part of the specimen was selected for analysis. They could include specific examples from their practice. The fourth knowledge requirement is need to log sample details and avoid sample mix-up. Candidates should know about the need to log sample details and how to avoid sample mix-up. You could ask them to explain how they would log sample details in your lab, why it is important to log them, and what would happen if there was a sample mix-up. You could ask them to explain how they would deal with a mix-up of specimens. When addressing this knowledge requirement, candidates should consider PID checks during specimen reception, labeling of samples, LIMS systems used in your lab, tracking systems used in your lab such as Vantage, macroscopic description of samples, details of blocks taken, sample after dissection and so on. The fifth knowledge requirement is need for further or alternate fixation methods. Candidates should know about the need for further or alternate fixation. You could ask the candidate to explain what specimens could need further fixation, if there are any alternative fixation methods used in your lab, and if so, what are they and why are they used? When addressing this knowledge requirement, candidates should consider resections that need opening or inflation, delay to fix samples, non-gynae fluids and their fixation method, frozen sections, immunofluorescence samples, renals, muscle and so on. The sixth knowledge requirement is need to pin out specimens. Candidates should know about the need for pinning out specimens. You could ask the candidate to explain why some specimens need to be pinned out, and to name types of samples that are usually pinned out. When addressing this knowledge requirement, candidates should consider anatomical orientation, shrinkage, curling, margins, head and neck resections, mucosal samples EMR, skin excisions. The seventh knowledge requirement is principles of tumor grading and staging with respect to tissue sampling. Candidates should know the principles of tumor grading and staging with respect to tissue sampling. You could ask the candidate to explain the principles of tumor grading and staging, and how tissue selection can affect tumor grading and staging. When addressing this knowledge requirement, candidates should consider specific principles of grading and staging like size, spread, cell appearance, aggressiveness, grading systems available, TNM system, or molecular profiling, sample adequacy, size and quality, sample representation, and sampling bias that can affect grading and staging tumors. The eighth knowledge requirement is rationale of tissue selection procedures in your laboratory, relative to your scope of practice. Candidates should know the rationale behind tissue selection in your lab, relevant to their scope of practice. You could ask them to write about the tissue selection procedures they perform, what the rationale of these procedures is, and how they would know they selected the right tissue for histological analysis. When addressing this knowledge requirement, candidates should consider SOPs, RC Path guidelines, or NICE guidelines, training and competency assessments. Ask them to use specific examples from their own practice. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is apply appropriate criteria for tissue selection within the cellular pathology lab. Candidates should be able to apply appropriate criteria for tissue selection. Does the candidate know and follow the criteria for tissue selection in your lab? What tissue selection procedures can they perform in your lab? Why are they selecting certain blocks for certain tissues? Candidates should show their understanding of the tissue selection procedures. When addressing this competence requirement, candidate could consider SOPs, RC Path and NICE guidelines, their training and competency documents, and local dissection protocols. The second competence requirement is assist with consultant-led specimen dissection and maintenance of appropriate specimen records. Candidates should be able to assist during specimen dissection and maintain records. How does the candidate assist pathologists or dissectors during dissection? How do they maintain appropriate specimen record? When addressing this competence requirement, candidate could consider electronic dictation, written notes on the form, macropath images, proformas, LIMS system, block guide, block details, specimen fate following dissection, inking of specimen, specimen orientation, specimen weighing, traceability of the sample following dissection and so on. The third competence requirement is take dictation at specimen dissection. Candidates should be able to take dictation during dissection. This links closely to the previous requirement. Does the candidate know how to take dictation when they assist during dissection? What form of dictation is it, digital or written? Why is dictation important and what would happen if the dictation was not taken or was incorrect? When addressing this competence requirement, candidate could consider electronic dictation, written notes on the form, macropath images, proformas, limb system, block guide, block details, specimen fate following dissection, inking guide, traceability of this following dissection, and so on. The fourth competence requirement is assist with the pinning out of specimens, as appropriate. Candidate should be able to assist with pinning out samples, if appropriate. Some samples are already pinned out when received to the lab, so they might not be able to assist with the pinning out of the specimens. However, they might be able to assist when the dissection of pinned out sample is performed in the lab. Does the candidate know how those samples are approached, or why it is important to follow the methodical approach for dissection of pinned out samples, and what could happen if those samples were not dissected methodically and precisely? When addressing this competence requirement, candidate consider local SOPs, RC path guidelines, dissection protocols, methodical approach, precise block guide, and so on. The fifth competence requirement is label cassette accurately in order to maintain the link between the sample and request. Candidate should be able to label cassettes accurately to maintain the link between the sample and request. Does the candidate know why is specimen labeling important? Do they know about the labeling system used in your lab to use it correctly? Do they know what could happen if the sample was incorrectly labeled? Can they generate cassettes for samples? Do they know how samples are tracked throughout the lab? When addressing this competence requirement, candidate could consider limb system, tracking system, methodology used to generate cassettes, equipment used to take cassettes, checking accuracy of generated cassettes, and so on. The sixth competence requirement is transfer Category A specimens from pot to cassette. Candidate should be able to transfer sample of Category A from the pot to the cassette. Does the candidate know what the Category A specimens are? Do they perform specimen transfer in your lab? Do they know what the key things are that need performed during the sample transfer? When addressing this competence requirement, candidate could consider description, special instructions, block details, PID checks, contamination, cleanliness, and so on. They could also consider specific examples from their practice and how they approach them during specimen transfer. The seventh competence requirement is troubleshoot problems which may arise, including root cause analysis, as appropriate. Candidate should be able to troubleshoot during tissue selection. Does the candidate know what problems could arise during specimen selection? How would they resolve the problems? When addressing this requirement, candidate could consider problems with cross-contamination, lost or missing sample, incorrect PID information, incorrect sample type, lost dictation, mix-up of samples, or incorrectly labeled cassettes. They could also consider possible resolutions of these problems. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. You could ask the candidate to complete tables you created, based on knowledge requirements. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.